Hi, I'm Dr. Matt Sheehan, chiropractor at Medford Family Chiropractic Center in Medford, Oregon, and I'm joined today by my friend Angie Orr, who is a licensed massage therapist here in the Valley, and we're making a short video showing people how to do a core exercise. It's a Pilates exercise, and I'm doing a modified version of a Pilates exercise. Pilates aficionados will look at this and probably be aghast at perhaps the ways that I'm doing it differently if they're purists. So please forgive me. I'm trying to get the most important essence of it as we go. So the reason we're doing this is an exercise for what we call the oblique muscles, which are these side muscles, and they're core muscles. And these are the muscles that both side bend us and they rotate the torso. But the muscles start about here and they wrap all the way around to the back. So they're vital to stabilizing the low back and the pelvis as core muscles. So we want to find a way to exercise them that's most effective. And Pilates is a brilliant way to do that. So we're going to go through two exercises. One of them is a side bending exercise and the other is a rotational exercise. So Angie's going to demonstrate these to us. So Angie, going to have you lie flat on your back to start. So what you're going to do, this is the classic crunch position, hands behind the head, elbows back. Try to relax your neck muscles and let your hands support your head. One of the most important parts is you want to keep a pelvic neutral position, meaning you want to have a slight arch in the small of your back, curved like this. You don't want, in the old days, old school, when we were doing crunches, we would teach people to flatten their low back out and keep the low back against the floor. Now we know that it's not physiological. We want to keep that curve because that's a natural curve, and it'll take some of the pressure off the discs while we're doing this, which is very important. So a little bit of a curve in the small of your back. Now first thing you want to do is, once you get that little bit of a curve there, a little bit of an arch, you're going to engage your abdominal muscles. And while you engage your abdominals, this is a little tricky because you want to engage your abdominals without flattening that curve out. So what we're actually doing is what we call a co-contraction, abdominal co-contraction. Meaning we're engaging both the abdominals in the front and the low back muscles in the back. Those low back muscles are what is going to basically keep that curve in the small of the back. So these muscles are kind of working against each other, but they're both vital. So you form the curve, engage the abdominals, but pay attention to not flattening out the small of the back. Once you get there, then you're gonna do similar to an old school crunch, where you're gonna raise your head and your torso, and you're gonna come up as far as you can without losing your curve here. Keep your abdominals engaged, keep that curve right there. It's not easy by any means. And you come up, and then we're gonna do a side bend, where you're going to slowly bring your torso over as far as you can and really concentrate on feeling this side tightening and really working. Hold it for a couple seconds and then keep your torso up and the abdominals engaged. You don't let your torso go back down. You're not sliding it on the floor. And then you come back to neutral, and then you slide to the opposite side. Really feel this side really working. Hold a couple seconds, come back to neutral, and then you just, as they say, rinse and repeat. Do it as many times as you can on each side until you feel the start of some moderate fatigue. Okay, that's the first one. Then go down and rest for 30 seconds, and then I want to show you how to do a rotational one. Similar setup, or exact same setup, with the curve in the small of your back. And you're going to engage your abdominals, keep that curve. And remember, the elbows you don't want to do what we used to do when we learned to do crunches, where you bring your elbows together and do that. You're not yanking on your neck, and you're not using your neck muscles. Your head is going to be back in line with the rest of your spine in an ideal world. And as Ange has it here, your elbows are back. And as you come up, There you go. You come up to, you really feel those muscles engage, feel a little bit of a curve there. It can take some work to figure this out, how to do both. It's not easy. But there you go, you're starting there, and now she's going to do a rotation where, and notice as she comes over, the elbow, that's right, that's the other thing we do is we start flapping the elbows, right, and so you want to keep those back, and you're really feeling the torso muscles rotating you down here. So you're really working on that rotation, and then you hold for a couple of seconds, come back to neutral, and you're staying up in you're staying in a crunch, and then you're going to roll this way. Okay. Ready. And then you want to stay up with your torso so it's off. There you go. You really feel the abdominals working, and now you're going to rotate this, rotate that. There we go. And really, you can see how her torso is really rotating. She's keeping her elbows back, her neck is relaxed. Really feeling that rotation for a couple seconds, and then go back to neutral. And you'll go left, right, again until you feel moderate fatigue, and quit. If you do one set of each, a couple times a week, that's great. That'll start to help a lot. There we go.